Welcome to the Retirement Classroom. Today's Masterclass is the most comprehensive Medicare guide you'll find anywhere. By the end of this video, you'll understand every part of Medicare, know exactly what you'll pay in 2026, and have specific strategies to save thousands on premiums and out-of-pocket costs. Whether you're approaching 65, already enrolled, or helping a parent navigate Medicare, this is the video you need. Let's start with the big picture. Medicare has four main parts. Part A covers hospital insurance. Part B covers medical insurance like doctor visits and outpatient care. Part C, also called Medicare Advantage, is a private plan alternative that bundles A and B together, and Part D covers prescription drugs. On top of these, you can add a Medigap supplement policy to fill coverage gaps. And if you have higher income, you'll pay IRMA surcharges on Parts B and D. I'm going to walk you through every single one of these in detail with real 2026 numbers. Let's start with Medicare Part A, hospital insurance. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. The good news, if you or your spouse worked and paid Medicare taxes for at least 40 quarters, that's 10 years, Part A is premium free. You've already paid for it through payroll taxes. If you have between 30 and 39 quarters, you'll pay a reduced premium of $311 per month in 2026. If you have fewer than 30 quarters, the full premium is $565 per month. Now here's where the costs add up. The Part A deductible in 2026 is $1,736 per benefit period. That's not per year, it's per benefit period. If you're hospitalized, discharged, and readmitted within 60 days, it's the same benefit period. But if there's a 60-day gap, you pay that deductible again. For hospital stays beyond 60 days, coinsurance kicks in at $434 per day for days 61 through 90. After 90 days, you start using lifetime reserve days at $868 per day, and you only get 60 of those in your entire lifetime. Skilled nursing facility coverage under Part A covers up to 100 days per benefit period, but only after a qualifying 3-day inpatient hospital stay. Days 1 through 20 are fully covered after your deductible. Days 21 through 100 require coinsurance of $217 per day in 2026. After 100 days, you're on your own. This is why long-term care planning is a completely separate conversation, and it's critical. Now Medicare Part B, medical insurance. Part B covers physician services, outpatient hospital care, durable medical equipment, and preventive services. The standard Part B premium for 2026 is $202.90 per month, up from $185 in 2025. That's a $17.90 increase. Roughly a 10% jump. The annual deductible is $283. After that, you typically pay 20% coinsurance, meaning Medicare pays 80% and you pay 20% of the approved amount with no cap on your 20% share. This uncapped 20% is the biggest gap in original Medicare and exactly why Medigap policies exist. One thing people consistently miss about Part B, preventive services are covered at 100% with no deductible. Annual wellness visits, cancer screenings, flu shots, cardiovascular screenings, diabetes screenings, all covered at zero cost to you. Take advantage of these. The Part B late enrollment penalty is permanent and painful. If you don't sign up when you're first eligible and don't have creditable employer coverage, you'll pay a 10% penalty on your Part B premium for every 12-month period you could have enrolled but didn't. And that penalty never goes away. If you delayed 2 years, you pay 20% more on your Part B premium for the rest of your life. Do not miss your enrollment window. Now let's talk about Medicare Part C, Medicare Advantage. This is where the decision gets interesting. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They replace Parts A and B, meaning you get all your Medicare coverage through a single private plan instead of through the government. Most Advantage plans also include Part D prescription drug coverage. In 2026, there are 3,373 Medicare Advantage plans available nationally. 67% charge no premium beyond your standard Part B premium, meaning the plan itself is essentially free. The average Advantage plan premium is just $14 per month. 57% of plans are HMO style, requiring you to use network providers. 42% are PPO plans, giving you more flexibility to see out-of-network providers at a higher cost. Here's what makes Advantage plans attractive. 98% of plans now include dental, vision, and hearing benefits that original Medicare does not cover at all. Many plans also include fitness benefits, meal delivery after hospital stays, and telehealth services. And the maximum out-of-pocket limit for in-network services in 2026 is $9,250. Once you hit that cap, you pay zero for covered services for the rest of the year. Original Medicare has no out-of-pocket maximum. But Advantage plans have significant trade-offs. Your provider network is limited. If your preferred doctor or hospital isn't in the plan's network, you either can't see them or you'll pay significantly more. Some services may require prior authorization. And critically, if you choose Advantage when you first enroll in Medicare and later decide to switch back to Original Medicare, you may not be able to get a Medigap policy without medical underwriting. This is a one-way door that many people don't realize until it's too late. Medicare. Part D covers prescription drugs, and 2026 brings major changes thanks to the Inflation Reduction Act. The biggest change, there is now an annual out-of-pocket cap on prescription drug costs. In 2026, this cap is $2,100. Before the Inflation Reduction Act, there was effectively no cap, and some beneficiaries paid $10,000, $20,000, even $50,000 per year for medications. The $2,100 cap is a game changer. The old coverage gap, the dreaded donut hole, has been eliminated entirely as of 2025. Under the old system, after you and your plan had spent a certain amount on drugs, you entered a gap where you paid the full cost until you hit catastrophic coverage. That gap no longer exists. Now it's a straightforward progression. You pay a deductible, then enter the initial coverage phase where you typically pay 25% coinsurance, and once you reach $2,100 in out-of-pocket spending, the plan covers everything. Insulin costs are capped at $35 per month for all Medicare-covered insulin products. If you're diabetic, this is potentially saving you thousands per year. All recommended adult vaccines are now covered with zero cost sharing, meaning no copay and no deductible for vaccines. The government has also negotiated prices directly on 10 high-cost drugs in 2026, with the list expanding significantly by 2029. These negotiated prices can save beneficiaries hundreds or even thousands on specific medications. And there's a new Medicare prescription payment plan that lets you spread your drug costs evenly throughout the year, instead of paying everything up front when you fill prescriptions. This is essentially an interest-free payment plan for your medications. The Part D late enrollment penalty is 1% of the national base beneficiary premium, which is $38.99 in 2026 for every full month you went without creditable drug coverage. If you delayed 14 months, that's a 14% penalty added to your premium permanently. Don't skip Part D unless you have other creditable drug coverage. Now, Medigap, also known as Medicare Supplement Insurance. Medigap policies are designed to fill the gaps in Original Medicare, specifically the deductibles, coinsurance, and copayments that Parts A and B don't cover. You can only use Medigap with Original Medicare. You cannot combine a Medigap policy with a Medicare Advantage plan. Let me repeat that because people get confused. Medigap and Medicare Advantage are mutually exclusive. Medigap plans are standardized by letter. The most popular and comprehensive plan is Plan G. Plan G covers the Part A deductible, Part A coinsurance and hospital costs, Part B coinsurance, Part B excess charges, skilled nursing facility coinsurance, and foreign travel emergency care. The only thing you pay out of pocket with Plan G is the annual Part B deductible, which is $283 in 2026. After that, everything is covered. For most retirees, Plan G provides the most complete coverage available. Plan N is the lower cost alternative. It covers most of the same gaps but has small copays for office visits and emergency room visits, and it does not cover Part B excess charges. The trade-off is that Plan N premiums are typically $30 to $60 per month, less than Plan G. If you're generally healthy and want to save on premiums, Plan N is worth considering. Critical timing note, your Medigap open enrollment period is the 6 months starting from the month you enroll in Part B. During this window, insurers must accept you regardless of health conditions and cannot charge more based on your medical history. If you miss this window, insurers can deny you coverage or charge significantly higher premiums based on your health. Do not miss this window. Now let's talk about IRMAA, the income-related monthly adjustment amount. This is the topic that catches the most people off guard. IRMAA is a surcharge on your Part B and Part D premiums that kicks in if your income exceeds certain thresholds. And here's the key. IRMAA is based on your modified adjusted gross income from 2 years ago. For 2026 premiums, they use your 2024 tax return. By the time you see the surcharge, it's too late to reduce the income that triggered it. Here are the 2026 IRMAA brackets. For individual filers, if your MEGI is up to $109,000, you pay the standard premium with no surcharge. From $109,001 to $136,000, you pay an additional $81.20 per month on Part B plus $14.50 per month on Part D. From $136,001 to $163,000, the surcharges increase Further, from 163,001 to 190,000, even more. And above 190,000, you're paying the maximum surcharge of $487 per month on Part B plus $91 per month on Part D. That's an extra $578 per month, nearly $7,000 per year in surcharges alone. For married filing jointly, those brackets double. The first tier starts at $218,000, then $272,000, $326,000, and $380,000. Here's the critical detail about IRMA that trips people up. It's a cliff, not a slope. If you're married, filing jointly, and your MAGI is $217,999, you pay zero surcharge. At $218,001, you pay the full Tier 2 surcharge. Crossing the threshold by a single dollar triggers the entire surcharge. This is why IRMA planning is essential. Let me give you 4 specific strategies to minimize IRMA. Strategy 1, strategic Roth conversions. Convert traditional IRA money to Roth in years before you turn 65 while your income is lower. Yes, you pay tax on the conversion, but once the money is in a Roth, future withdrawals don't count toward MAGI and don't trigger IRMA. Strategy 2, qualified charitable distributions. If you're 70 and a half or older, you can donate up to $111,000 directly from your IRA to qualified charities. QCDs satisfy your required minimum distribution, but don't appear in your adjusted gross income, keeping your MAGI lower. Strategy 3, manage capital gains timing. If you're near an IRMA threshold, avoid realizing large capital gains in the same year. Spread gains across multiple years to stay below the cliff. And strategy 4, appeal using Form SSA 44 if you've had a life-changing event. Retirement, death of spouse, divorce, marriage, or loss of income-producing property all qualify. If any of these happen and your income dropped, you can request that Social Security use your current year income instead of the 2-year-old tax return. Let's cover enrollment periods because missing these deadlines can cost you thousands. Your initial enrollment period is the 7 months surrounding your 65th birthday, 3 months before the month of your birthday, and 3 months after. For example, if you turn 65 in June 2026, your IEP runs from March through September 2026. Enroll in Part A, Part B, and Part D during this window to avoid penalties. The annual enrollment period runs from October 15th through December 7th every year. During this window, you can switch between Original Medicare and Medicare Advantage, change your Advantage plan, or add, drop, or change your Part D plan. Changes take effect January 1st. The Medicare Advantage open enrollment period runs from January 1st through March 31st. If you're already enrolled in a Medicare Advantage plan, you can make one change during this window. Switch to a different Advantage plan, or drop Advantage and return to Original Medicare. If you have a qualifying life event like moving to a new area, losing employer coverage, or qualifying for Medicaid, you may be eligible for a special enrollment period that lets you make changes outside the standard enrollment windows. Let me close with the most common Medicare mistakes I see retirees make. Mistake 1, not enrolling on time. The penalties for late Part B and Part D enrollment are permanent and add up to thousands over your lifetime. Unless you have creditable employer coverage, enroll during your initial enrollment period. Mistake 2, choosing Medicare Advantage without understanding the trade-offs. The zero premium appeal is strong, but if your doctors aren't in network or you need specialized care, the cost can be far higher than Original Medicare plus Medigap. Mistake 3, not comparing plans annually. Medicare Advantage and Part D plans change their premiums, formularies, and networks every year. What was the best plan last year might not be the best this year. Always review during the annual enrollment period. Mistake 4, ignoring IRMA until it's too late. Start planning your income strategy years before turning 65. The 2-year look-back means you need to act now. Mistake 5, not considering the Medigap window. You have exactly 6 months after enrolling in Part B to get guaranteed issue Medigap coverage. Miss that window, and you may never get affordable supplement coverage. Here's your action plan. If you're approaching 65, mark your initial enrollment period on the calendar and research whether Original Medicare plus Medigap or Medicare Advantage is right for you. If you're already enrolled, review your plan during the annual enrollment period every October. Regardless of where you are, start RMAA planning now. Talk to your tax advisor about Roth conversions and income management strategies. And if you're on expensive medications, check if they're among the drugs with negotiated prices or if a different Part D plan would save you money. If you found this masterclass helpful, subscribe for more retirement education. And if you want a free Medicare consultation to review your specific situation, check the link in the description. Class dismissed.
Hey, before you go, if you're serious about your retirement, we'd love to help. Scan the QR code on screen right now or visit the link in the description to book a completely free strategy session with a qualified professional. It only takes a couple minutes to fill out, and there's absolutely no obligation. Take the first step today. We'll see you in the next one.